Attendees are in listen-only mode.
Hello everyone, welcome to another presentation in the HSVMA Continuing Education webinar series. We're really glad you could join us tonight. I'm Lorna Grandy and I'll be your moderator. I am the HSVMA CE advisor and I help to produce this webinar series. We're really excited to have Dr. Gary Richter as our presenter this evening, and we know that you guys are too. This cannabis topic is one that has brought about a lot of interest, and so we're really glad that so many of you are here with us tonight. Before we get started, I just want to go over some technical information. All attendees are muted to minimize background noise, and so if we have any technical difficulties, please be patient with us and we'll get to them as quickly as we possibly can. We recommend that you do close out all other programs on your computer for a better listening experience. If you do have trouble with reception during this live broadcast, it is being recorded and will be archived so that you can listen to it later. Most of you out there are HSVMA members. Just give me a chance to tell you a little bit about HSVMA. The Humane Society Veterinary Medical Association is a national association for veterinarians and veterinary technicians founded in 2008. Our focus is on animal health and welfare. These photos are from a few of our programs. HSVMA provides a forum for veterinarians to advocate, educate, and serve. During 2017, more than 1,000 veterinary professionals joined HSVMA in actively advocating for advancements in animal welfare on a variety of federal and state legislative issues. Those include a federal law called the PASS Act, Prevent All Soring Tactics, to end the inhumane practice of horse soring, and state laws regarding veterinary reporting of animal abuse, puppy mills, inhumane trapping and hunting methods, and the extreme confinement of farm animals. We also have a state representative program with veterinarians in over 20 states representing us on legislative and outreach efforts. HSVMA partners with various HSUS programs to offer field service opportunities for veterinarians and technicians. One of the service programs is RAVS, Rural Area Veterinary Services, and RAVS works in rural areas where the communities are dramatically underserved. And if you're interested in working with RAVS or going on a RAVS program or be involved in any of our service programs, please contact HSVMA. We'd be happy to talk to you about it. So before we get started, I just want to tell you that you don't have to worry about writing everything down tonight. We will be sending you a follow-up email this evening after the webinar, and that will have a PDF of the entire PowerPoint presentation. But right now, if you look at your control panel, there's a handout which has a summary of this program that you'd be able to download and look at right now as Dr. Richter is talking to us. If you have a question, please type it into the questions section of the control panel. We will get to as many of them as we possibly can at the end of the presentation this evening. We're sure there are going to be a lot of questions, so we are going to try to get to as many of them as we possibly can. So again, judging from tonight's big turnout, we think that many veterinarian professionals are looking for guidance about the use of cannabis, and HSVMA is proud to bring this conversation to the table, and we welcome your feedback. Tonight's speaker is Dr. Gary Richter. He is an expert in both conventional and holistic treatment methods. He graduated from the University of Florida with an MS in veterinary science and a DVM. In 1998, he began his career as an emergency clinician and general practitioner in Berkeley, California. Dr. Richter has been the owner and medical director of Montclair Veterinary Hospital since 2002 and Holistic Veterinary Care since 2009. Dr. Richter is a past president of the Alameda County Veterinary Medical Association and continues to serve as the California VMA's Alameda County Veterinary Disaster Response Coordinator. His two hospitals have been the recipients of more than 20 local and national awards, including Best Veterinary Hospital and Best Canine Therapy Facility. Montclair Veterinary Hospital and its associated nonprofit, the Pet and Wildlife Fund, was named a pillar of Oakland for years of community service, helping animals and wildlife in need. In addition, Dr. Richter is an international best-selling author of The Ultimate Pet Health Guide Dr. Richter, we're really happy to have you here tonight, and take it away.
Thank you so much. What a wonderful introduction, and I'm so happy to be here and to have so many people interested in this really important topic of medical cannabis for pets. So let's go ahead and get right on it. I think regardless of everything else and all of the controversy, we really do have to kind of continue to see the humor in all of this. There's no fun in working if you can't have fun. But let's begin with cannabis as medicine, and particularly why we are even talking about this topic. The first reports of cannabis use as medicine were up to 4,000 years ago, and even much more than that if you look at cannabis as an agricultural crop of upwards of 10,000 years ago. In fact, there are some theories that cannabis may have actually been the first plant cultivated by man, which is really interesting if you think about it. The birthplace of civilization occurred when man changed from being a hunter-gatherer to an agrarian community. It is interesting that in this day and age where cannabis is such a controversial topic, this may actually be the plant that was the cornerstone of human civilization. Cannabinoids, which we are going to talk about extensively in this talk, have profound effects on the body, both good and bad, which makes them a very important thing to talk about, particularly when we're looking at cannabis as medicine. And if you just go online to PubMed and you just search for cannabis, you are going to find over 15,000 research papers. This is a very well-studied, well-looked-at plant, and it is certainly something that is worthy of our discussion in the veterinary community. And just in case that wasn't enough for you, this was the cover of Time magazine as I was standing in the checkout line at the grocery store a few weeks ago. This is not a fringe issue. This is in the forefront of many people's minds. When people are standing there in the checkout stand and this is what they're seeing, you can be assured that they're starting to think about cannabis beyond the scope of reefer madness and all of the horrible things that it can do. So as we get into this conversation, I'd love to just take a moment and ask the participants, how frequently are you being asked about the medical use of cannabis by your clients? I know that it's something that in my office is literally a daily occurrence, and most veterinarians I know out here in California are fielding these questions on a regular basis. So I'd be very curious to hear, how many people out there are dealing with these questions from clients, and how often you're dealing with them, because, as I say, I mean, so many people out in the world now are having personal experiences with cannabis as medicine for themselves and for their family members. It's only to be expected that these people are going to start to wonder about whether or not it can be used for similar conditions for their pets. So it's certainly not a surprising thing. Okay, so we have some results, and it looks like a lot of people out there are seeing these questions frequently. 32% of you are saying that you're getting weekly questions, and another 31% monthly. If we add that to the daily, we're upwards of almost 3/4 of the participants here are dealing with at least monthly questions. So that is not surprising. So let's move on from here and start talking about what we can learn about how cannabis works. So in order to begin this conversation, we really have to talk about the endocannabinoid system. So if this is not a term that you've heard before, that's not super surprising because it's not something that they taught any of us in veterinary school. The endocannabinoid system, it's a system of receptors throughout the nervous system. And the endocannabinoid system has its own specific neurotransmitters, and the components within cannabis, the phytocannabinoids, which we'll talk about in a little bit, have similar activities with these receptors as well. So as far as what the purpose of the endocannabinoid system does, it's the neuromodulating system. And effectively what it does is it's altering the function and the behavior of tissues with the specific goal of promoting homeostasis. So, to be clear, what the endocannabinoid system is doing is it is helping to keep the body in balance. And as we start to look at the scope of the endocannabinoid system, you'll start to realize how and why it is that cannabis as a plant can affect so many different body systems in so many profound ways. So really there are three main facets or pillars, if you will, of the endocannabinoid system. There are the receptors themselves, the neurotransmitters, the endocannabinoids, and then there are regulatory enzymes that affect how these neurotransmitters work. So let's begin with the receptors. There are endocannabinoid receptors present on neurons and cells throughout the body. There are many, many different specific receptors and types of receptors. The G protein coupled receptors are the ones that are the most commonly found, and specifically the CB1 and CB2 receptors are the ones that have been the most studied, because those are the ones that, at least for the time being, appear to have the most profound effects on the body. But in addition to these G protein coupled receptors, there are ligand-gated ion channels, and there are also nuclear receptors. So these receptors are literally present throughout the body, the central nervous system, the peripheral nervous system, throughout the periphery, which is why these cannabinoids have such a global effect on the body. Let's talk about the CB1 receptor to begin with, because that really is a very, very profound player in the endocannabinoid system. In fact, the CB1 receptor is the most abundant protein-based receptor found in the human brain and central nervous system. So you can see that this is so prominent, it outnumbers any other type of protein-bound receptor that's found in the CNS. What does it do? It does a lot, but particularly what it does is it mediates the inhibitory action on the release of other neurotransmitters: dopamine, GABA, glutamine, serotonin, noradrenaline, acetylcholine. All of these neurotransmitters are affected by the level of endocannabinoids in the body system. And that in many cases is why cannabis has its psychoactivity, and it has these profound effects, is because it is able to affect the levels of all of these different neurotransmitters in the body. So, clearly the functions in this sense are going to have a lot to do with mood and cognition and perception and reduction of pain and inflammation. And as I was just mentioning, because of all these profound effects on these other neurotransmitters, this is why we have the psychoactive effects of THC, which we're going to talk about in a little bit. In addition to being in the central nervous system, CB1 receptors are found throughout the body: fat cells, liver cells, in the musculoskeletal tissues. The GI tract is loaded with cannabinoid receptors. So as you can see, these receptors are found throughout the body. The CB2 receptor, on the other hand, tends to be a little bit more of a peripheral system receptor. Specifically, these receptors are expressed on immune system cells, T cells, B cells, macrophages, although we also see them in other organs such as the liver, the kidneys, and the skin. So whereas the CB1 receptors have a lot to do with mood, psychoactivity, the CB2 receptors have more to do with immune modulation and anti-inflammatory effects, because those are the tissues that they tend to be the most prevalent in. Now, the endocannabinoids. So these are the transmitters themselves. The endocannabinoids, they will interact with the receptors on the neurons and the other cells. So there are a couple of main players, if you will, when it comes to endocannabinoids. The first one is called anandamide, frequently abbreviated AEA. And anandamide is the primary endogenous ligand for the CB1 receptor. whereas 2-AG, 2-arachidonyl glycerol, is the primary endogenous ligand for the CB2 receptor, although it is worth mentioning that 2-AG is also a CB1 agonist, and it is a retrograde neurotransmitter, which I'm going to show you in a moment in a diagram, but that becomes a very, very important aspect of how the endocannabinoid system functions. There are also degradation enzymes that occur in the endocannabinoid system, most primarily fatty acid amide hydrolase, also frequently referred to as FA. These will degrade the endocannabinoid transmitters themselves. I think it's interesting to mention that there has been a fair bit of drug research into FA inhibitors. So basically, these would be drugs that would increase the activity of endocannabinoids by virtue of decreasing their rate of degradation. There have been a number of drug studies on FA inhibitors. One of them in particular was an unmitigated disaster in the sense that many of the people involved in the study got sick and one of them actually died. So FA inhibiting drugs, they do not appear to be anywhere quite close to reaching clinical use. Monoacylglycerol lipase is a specific hydrolyzer of 2-AG. And then there's also fatty acid binding proteins. These are proteins that mediate the transport of anandamide into and out of the neurons, which are going to affect how rapidly they're degraded based on their exposure to FA. And they also, by the way, are going to be transporters of THC and CBD that are found in cannabis. So, again, THC and CBD, which we're going to talk about in a moment, will have a lot to do with affecting the endocannabinoid system in much the same way that anandamide and 2-AG will. So now let's just look for a moment about how all of this works. So if we start at the top of this diagram here where it says action potential. So, an action potential comes down the presynaptic neuron, which is going to open the calcium channel, which as you remember, is going to stimulate the release of neurotransmitters. However, we've got the cannabinoids, or the endocannabinoids, that are present in the neurons also are affecting the rate and amount of release of these neurotransmitters. So it's kind of it's a process that's relying on more than one input. As the neurotransmitters travel across the synaptic cleft, what's happening is that 2-AG, which is in the postsynaptic neuron, is released. And now you'll recall that I said that it is a retrograde neurotransmitter. 2-AG is going to go backwards across the synapse and then interact with this CB1 receptor and be transported into the cell where, again, it is going to affect the rate of neurotransmitter release and also where it is going to be presented to the degradation enzymes, which are going to then degrade the cannabinoids to maintain the balance. So as you can see, this is it is a complex system. It is a complex dance. This, quite frankly, is a bit of a is even a bit of a simplified version of how all this works, and the research is really ongoing. So now, as we move into cannabis itself, I think it's important to mention that cannabis contains a lot of active chemicals. It's not just THC and CBD. Certainly, the phytocannabinoids that are present within cannabis have a lot to do with its physiologic effect. And more than just THC and CBD, there are many, many other cannabinoids that have physiologic effect. And these various phytocannabinoids will have different affinities for different cannabinoid receptors. Now, I've just put this slide in here just as a reference for you so that you can see how many different cannabinoids there are out there. Obviously, it's not important that you know and understand what all of these things do, but I think it is important to remember that as the science of medical cannabis goes forward, you are going to start to see some of these cannabinoids come into play as far as medicine goes. It's not all going to be about THC and CBD. But THC and CBD are clearly the big players, at least for right now. So let's talk about THC, delta-9 tetrahydrocannabinol. So delta-9 tetrahydrocannabinol is a partial agonist of CB1 and CB2 receptors, and it's phytomimenic for anandamide, which is why it has these similar effects as far as affecting neurotransmitters. The psychoactivity occurs through the binding of CB1 receptors, which is going to increase the release of certain neurotransmitters, such as serotonin and some of these other neurotransmitters that are going to affect cognitive function. Interestingly, it also binds the fatty acid binding protein, which is going to limit anandamide's degradation by Fa. So in addition to having its own specific effects, it actually is going to sort of promote the effects of anandamide by decreasing its degradation. As an interesting aside, it is also a positive allosteric modulator of the opioid receptors mu and delta, which has a lot to do why it has the pain relieving effects that it does. Pharmacokinetically speaking, delta-9 THC is absorbed depending on how it's ingested, but it's distributed to the fat, the liver, the lungs, and the spleen. It is then hydroxylated in the liver to another compound called 11-hydroxy delta-9 THC. This is actually the more profoundly psychoactive compound than delta-9 THC. So it's after it's passed through the liver that you can really start to see the profound psychoactive effects. Then as things progress, that 11-hydroxy delta-9 is then secondarily oxidized to 11-norhydroxy carboxy delta-9, which is a non-psychoactive compound, which ultimately goes through several processes to where it is excreted, generally speaking, through the feces, although there is a certain degree of renal excretion as well. The other big player, CBD, or cannabidiol, cannabidiol has a somewhat lower binding affinity for CB1 and CB2 receptors, but realize it's CB1 and CB2 receptors, and it's an antagonist for both of these receptors. Interestingly, cannabidiol is a Fa inhibitor in mice, but not in humans, so says the research. So to be quite honest with you, I don't think that we really know where things sit as far as most veterinary patients go in this regards. But if there is Fa inhibition, obviously it is going to increase the activity of the endocannabinoids by decreasing their degradation. Just like THC, it's going to bind fatty acid binding protein and decrease AEA's degradation by Fa as well. Now, CBD may also dampen and extend the psychoactive effects of THC through cytochrome P450 inhibition, which I'll explain in just one second. And then just like THC, it is also a positive allosteric modulator of opioid receptors, which is one of the reasons why CBD as well as THC have such a profound effect on pain control. When we look at the metabolism of CBD, orally ingested cannabidiol is not well absorbed in dogs. One of the original pharmacokinetic studies on CBD showed that there was between 0 and 19% absorption of CBD when it is ingested and absorbed through the gastrointestinal tract. That was presumed to be due to first pass effects, although I think it's important to realize that in this study in particular, nobody looked to see if there were active metabolites. So just like with THC, where the metabolite is actually the more profoundly psychoactive, nobody actually looked to see if there was an active metabolite in this study. So it's kind of unknown whether or not that is a factor. CBD is then converted to 7-hydroxy and 6-hydroxy CBD in the liver by cytochrome P450. Now, this is where things get kind of interesting. CBD appears to be a competitive inhibitor of cytochrome P450. So you'll recall a minute or two ago I was saying that CBD can affect the psychoactivity of THC, and this is why this is thought to happen, because if CBD is going to tie up cytochrome P450, it is also going to slow the conversion of delta-9 THC to 11-hydroxy delta-9 THC, the more psychoactive compound. So it will effectively slow the conversion, therefore decrease the amount of psychoactivity, although it is also thought to draw out the amount of time by which it's metabolized. In fact, there are some people who advocate for using CBD in cases of THC toxicity for exactly this reason. The other reason why cytochrome P450 is of potential concern is, as you very well know, there are many pharmaceuticals that are metabolized by cytochrome P450. So at least theoretically, concurrent CBD use with such drugs, like for example phenobarbital, may affect the levels of phenobarbital in the blood. So these are definitely things that we need to consider when we start looking at the potential benefits and pitfalls of using cannabis as medicine. Again, I've just put this slide in here just for your reference sake, just to see these various cannabinoids, where they fall in sort of the process of cannabis, and what their general biological actions are. We're not going to go through any of this, but I would encourage you to go back and look at it at your leisure. As I mentioned before, cannabis is much more than just THC and CBD, and really much more than just the cannabinoids. In fact, one of the major components of cannabis are compounds called terpenes. Terpenes, if you're familiar with essential oils are terpenes. We all sort of experience terpenes in our daily life. The things that make lemons smell like lemons and oranges smell like oranges, etc. Flowers that smell like flowers. These are all terpenes that are naturally produced by plants. One of the major terpenes in cannabis, beta-caryophyllene, interestingly enough, in addition to being biologically active in other ways, is actually a CB2 agonist. And as such, beta-caryophyllene is now being thought in some circles as another cannabinoid. Like many other plants, cannabis also contains flavonoids, which are plant-based antioxidants. These tend not to be as big a player when we start looking at various medical uses for cannabis, but clearly any kind of naturally formed antioxidant is generally considered a plus from a medical standpoint. So yet again, here is another couple of slides that I'm just putting in here for your reference. These are a list of the naturally occurring terpenes in cannabis and some of their potential medical benefits. Not all terpenes occur in all varieties of cannabis, which is why different strains are frequently thought to have different medical properties. So here's half the list. Here is the other half of the list. I encourage you to go back at your leisure and study these. It is absolutely fascinating when you start to look at the scope of compounds that are found in cannabis. So now that you have an idea of all of the different compounds that are found in cannabis, you can see why we're really talking about much more than one or two things. And when we look at whole plant medicine, and particularly in the discussion of cannabis as medicine, you will frequently hear a term used called the entourage effect. And essentially what that means is that the full scope of naturally occurring compounds in a plant are going to have a synergistic effect. Their effect is going to be greater than the sum of their parts. And isolating compounds frequently don't work as well as whole plant extracts. So for example, you may have heard of the pharmaceuticals Marinol and Drobanol. These are basically synthetic THC and CBD. They have been used in cancer patients to help with pain and to help with nausea. And generally speaking, the report from most people who have ingested these drugs has been sort of just, non-committal. It worked a little, didn't work great. Many people who've taken these medications feel like whole plant cannabis works better, and that is almost certainly due to the entourage effect. Now, when we start talking about cannabis, we can't get around the concerns that people have about THC and THC toxicity. And there is absolutely every reason to be concerned about that, and we're going to talk about that in great length. Although I think it is very important just to start the conversation by saying that there is no LD50 for THC in dogs. The research would indicate that dosages of greater than 3,000 milligrams per kilogram of THC have been administered to dogs without a fatality. I would ask any veterinarian or veterinary professional, how many drugs in your veterinary pharmacy meet this standard of safety? I can't think of too many that are that non-toxic in the sense that that there is not a known lethal dose. Clearly, there is such a thing as THC toxicity, which is very, very worth us talking about. But before we get to that, there is one more thing about the pharmacokinetics of cannabis that is very important to remember. Cannabis tends to follow what is called a biphasic dosing curve. And essentially what that means is that from the standpoint of optimal therapeutic effect, there's kind of a sweet spot, if you will. So, lower doses may not work very well. As we increase the dose, the effects get better. And as we increase the dose further, frequently the positive effects tend to taper off a little bit. And this is important to realize because I think it's a very natural human tendency to say, well, if a little is good, more is better. And frequently when people are using cannabis, sometimes they feel like they're starting to feel the effects decreasing and their natural tendency is to take more. Well, sometimes that's exactly the wrong thing to do, because if they've sort of crested the biphasic dosing curve, if you will, the best thing that you can do is actually decrease the dosage a little. And as we get into talking about sort of specific dosing regimens, you'll see why this really becomes important. So let's talk about the specific medical uses for cannabis in pets. And I'll preface this conversation by saying that there is very, very little clinical research looking at disease treatment in animals using cannabis. And much of what I'm going to discuss with you is extrapolated from the human data, although I can tell you from personal experience, I have seen animals respond highly, highly positively to just about, not even just about, to every single thing on this list. I have seen animals improve with the use of cannabis. So let's talk about a couple of studies. And as I say, most of these studies are in humans, but they are very applicable. Low-dose vaporized cannabis significantly improves neuropathic pain. I think we've all had patients with neuropathic pain and understand how difficult it can be to control that degree of pain. Here's another study looking at a THC to CBD extract to treat patients with intractable cancer pain. And if you look at the bottom line there, THC CBD extract is efficacious for relief in pain in patients with advanced cancer pain not fully relieved by strong opioids. So I just want to be super clear in pointing this out. This is not just any pain that this extract was efficacious in relieving pain. This is the worst of the worst. This is intractable cancer pain that opioids can't touch. These are patients that have no quality of life because of the level of their pain, and cannabis was efficacious in giving them relief. If you've ever talked to somebody with that degree of chronic pain, you cannot put a price on that. Gastrointestinal disease. Cannabis has been shown to be very, very effective in patients with Crohn's disease. We all have patients that have inflammatory bowel disease, have colitis. Many of these things are very sort of analogous to Crohn's disease. In this case, an 8-week course of a THC-dominant cannabis product produced steroid-free benefits in 10 of 11 patients. I would like to get response in 10 of 11 of my inflammatory bowel disease patients without putting them on prednisone, and I can assure you that my clients would love that as well. I'm sure yours would too. When we look at cancer, there are quite a few studies. When we look at just the mechanism of actions, CBD inhibits angiogenesis. In this study, cannabinoids induce apoptosis and are angiogenic inhibitors in animal models of cancer. Here's another one that looks at THC and CBD as radiation sensitizers. So, you know, almost every facet of what we would like chemotherapy to do, cannabis has the ability to do as well. Now, I certainly wouldn't advocate to use cannabis, you know, as a replacement for chemotherapy, but I think it definitely deserves a look as part of a multi-drug protocol. When we look at neurology, here's a fascinating thing. CBD-enriched cannabis is effective for intractable pediatric epilepsy. So if we look at this study, over 50% of patients had between a 50 and 100% reduction in seizures. Now again, just like the pain study with cancer, this is not just any seizure patient. This is not any kid with seizures. These are the kids that don't respond to pharmaceutical therapy. These are the kids that are having 50 or 100 seizures a day on multiple pharmaceuticals and nothing is touching them. And 50% of them had a 50 to 100% reduction in seizures. And just as an FYI, the FDA just recently approved a medication called Epidiolex made by GW Pharmaceuticals, which is a derivation. It's made from CBD, and it's just been approved to treat pediatric epilepsy. Here's a fascinating study that I think is really worth putting a little thought into. Degenerative myelopathy, which, as you know, is kind of a research model for ALS in people. Turns out that there's an upregulation of CB2 receptors in the reactive astrocytes in dogs with DM. To be honest with you, I'm not really sure what the significance of this is and what this means, but I think it's fascinating that somehow the endocannabinoid system is reacting in these neurons of these dogs with degenerative myelopathy. Whether or not that means some form of cannabis will ultimately be able to help these animals and potentially people with ALS, that is going to be a bit of a time will tell thing, but a fascinating finding nonetheless. Behavioral. You know, when we look at people with post-traumatic stress disorder, CBD can be very, very effective in treating these people. Why is that? You know, if we go back and we look at the at how the endocannabinoid system works, CBD is going to affect both the release of GABA and serotonin. So that is going to have a huge effect on people's mood, on people's demeanor. You can see how that would make a difference. Now, if you start to think about the animals that we see in our practices, particularly the ones that come out of shelters, out of rescue organizations, you know, if these animals don't have PTSD, I don't know who does. And I can tell you that that cannabis and CBD in particular can be very, very beneficial for these animals. Here's a couple of veterinary specific studies. This one came out last year looking at the synovial fluid in dogs, where the researchers found endocannabinoids and entourage compounds in the joint fluid. So what does that tell us? That tells us that there is a role for cannabis in the treatment of arthritis. And I'm very, very happy to be able to tell you that, that Joe Watchlog in Cornell is getting ready to publish a paper. It was actually, the abstract was just recently published online, that shows that CBD was effective at treating dogs with arthritis. Now, interestingly, the dosage of CBD that they used was 2 milligrams per kilogram, which is a lot of CBD. And from just from a nuts and bolts standpoint, that would be a fairly expensive dose of CBD for your average, you know, your average client. What I will say is that may actually be an indication and a reason to start thinking about the entourage effect, that perhaps if we look at adding other cannabinoids into the CBD, maybe we can get away with a lower dose of CBD and make these medications more affordable. So as you can see, they found statistically significant reductions in pain and an increase in activity in these dogs, and no negative side effects were found. Again, we'll take a moment to enjoy the comedy of all of this, because given all of the controversy that surrounds this, if you can't maintain your sense of humor, it'll wear on you. Now let's talk a little bit about toxicity before we actually get into therapeutic dosing because it is important to address this. Interestingly, dogs have an incredibly high concentration of endocannabinoid receptors in their cerebellum, more than other species that have been evaluated. So what the result of that is that THC toxicity in a dog is a particularly unique thing. And I would imagine that most veterinarians and most veterinary professionals these days have probably seen what that looks like, because you've probably had somebody come into your office where the dog ate the stash, or somebody tried to medicate their dog and had no idea what they were doing. But in case you haven't seen it, let me just show you a couple of videos. This is a little puppy. You can see the level of ataxia that's going on with these animals. Here's another one. It's a bit of a longer video. You know, you can see that what they call static ataxia. So, you know, they're losing their balance. They're sort of cognitively there but not there. You know, this is very, very typical of THC toxicity. Now, the good news, because as we mentioned before, THC really does not have a known LD50, the vast majority of these animals will ultimately be fine, although some of them will require supportive care, particularly if they're not able to eat or drink for the period of time until it's metabolized. Now, I put this photo in here as a reminder that even though there's no such thing as an LD50 for cannabis, that does not mean that a dog or a cat, for that matter, cannot die from cannabis toxicity. This is a case of a dog that presented to my office 24 hours after having eaten cannabis edibles that were intended for the owner. The dog had been unconscious for almost 24 hours, and by the time it got to our office, the dog, unfortunately, the night before had apparently vomited and aspirated, and ultimately he died of pneumonia and sepsis. So, you know, I think the bottom line here is although in the very technical sense you could say that this dog did not die from THC toxicity, clearly it did die from cannabis ingestion. So, you know, I think it's very important to realize and to impress upon people that just because cannabis is safe, it does not mean that something bad cannot happen. You know, there's sort of the urban myth going on out there that, well, you know, it's impossible to kill anything with cannabis. Well, I'm here to tell you that unfortunately that is not true. So with that rather depressing scene in the past, let's move on to how to look at using cannabis successfully as medicine. So for starters, always remember the entourage effect, because it's more than just THC and CBD. It's the major and minor cannabinoids, it's the terpenes, it's the flavonoids that are going to affect the biological activity of the medicine and the spectrum of diseases that can be treated. Now, to be clear, depending on where you live, you probably will not have the opportunity to shop cannabis products based on minor cannabinoids and terpene profiles. But it's important for me to bring this up to you because in coming years, that is exactly what's going to happen. So as we gain a better understanding of how these compounds work, you are going to see medications that are going to develop taking advantage of that entourage effect. Now, when it comes to whole plant medicine, specific phenotypes and chemotypes are being used to study medical conditions. Now, I imagine that most of you remember the term phenotype as being the physical manifestation of an organism's genetic makeup. You know, so for example, you can have two plants with the exact same genetic makeup, but you know, because of where they're grown or how they're grown, they may look differently, and that is their varying phenotypes. There is this other term in cannabis medicine called chemotype, and that is an important term to understand. Chemotype basically refers to the spectrum of chemical compounds found within a plant, and that has to do with more than just the genetics and the phenotype. That also has to do with how the plant is prepared. So for example, I could take a single cannabis plant, when it's ready for harvest, divide it in two, and if one of them is prepared as a fresh plant and the other one is dried and heated, the chemical components of those two preparations are going to be vastly different and have very, very different medical properties. And that's referred to as chemotype. So when you're looking at cannabis preparations, it's not only important to sort of look at you know, what it says is, for example, the THC to CBD ratio, but it's very important to know how that was prepared, because that is going to make a difference on how that product is going to act. And then lastly, particularly as we sit here today and we look at cannabis as medicine, the appropriate THC to CBD ratio and the relative amount of each one are really critical to success. And quite frankly, those are by far the parameters that you're going to be looking at right now, which is THC to CBD ratio and the relative number of milligrams of each one of those. So let's really get to the nuts and bolts of this thing. Let's talk about the different ratios of medical cannabis and how it will affect physiology differently. So we're going to start with high THC, or what is sometimes called THC dominant medications. Now the ratios can vary here depending on the preparation, potentially anywhere from 4:1 to 20:1 THC to CBD. Classically, these are used for severe pain, particularly cancer pain or advanced degenerative joint disease. They can be used for appetite stimulation. They also have anti-cancer activities. Let me just take a quick moment to say that as we go through these various ratios and we're talking about these different medical benefits, none of this is written in stone. These are guidelines. You know, please don't come away with this that if you have a dog with severe pain, it has to be on a THC dominant product. It doesn't. It is going to vary greatly between the individual animal and then also, again, some of the other components present in the cannabis, whether it's terpenes or other cannabinoids. So just look at these as a guideline, and we'll move on from there. So even ratio products, those will be a 1-to-1 ratio, the same amount of THC and CBD. These are thought to be neuroprotective, so spinal cord injuries, brain injuries, disc disease, what have you. They can also be very beneficial for pain. I have seen quite a few animals with inflammatory bowel disease and pancreatitis or colitis improve on 1-to-1 ratio products. They also have anti-cancer activities. You'll find that many of the cannabinoids have anti-cancer activities, so you will see that sort of listed throughout. Then we look at the CBD dominant or high CBD ratio products. This is essentially the inverse ratio of the THC dominant product, so 1-to-4 or upwards of 1-to-20 THC to CBD ratios. These preparations tend to be used for anxiety. They can be very, very beneficial for seizures, cognitive dysfunction. You know, whether or not these products actually improve cognitive function in these animals, or it just helps with the anxiety and the restlessness, I think that may be up for debate, but one way or the other, if the animal's more comfortable and the client is happier, then you know, I think that's a plus. CBD can be helpful for pain. It has anti-cancer activity, and interestingly, it also can help with insulin resistance and diabetic control in type 2 diabetics. I have seen, and I have had other colleagues, other veterinarians who have used cannabis in type 2 diabetics and actually got these animals to convert to a non-insulin dependent state. Now, clearly all that is going to depend on lots of other factors, including what they're eating and what they weigh and all of the other things that you normally think about when you think about a cat with type 2 diabetes. But it might be time to think about adding in CBD as part of the treatment regimen. Now, I've also put in hemp here. You'll notice that the list of applications here for hemp is exactly the same as that for the high CBD compounds. But I just want to mention hemp specifically because hemp-based CBD is the stuff that most of your clients are probably going out and buying. These are the products that are available online, over the counter, at pet stores, at health food stores, etc. Legally speaking, the definition of hemp is a cannabis plant that naturally produces less than 0.3% THC. So you know that is sort of the legal line, if you will, between hemp and Schedule I marijuana. And I think it's worth saying that there certainly are benefits to hemp-based CBD. So let's talk for a moment about hemp, because there's a lot of confusion and a lot of misconceptions out there, largely because, not surprisingly, a lot of people have a lot of opinions when it comes to these sorts of things. So, you know, there are people who are very much in the camp of cannabis being a full spectrum entourage effect plant, and therefore hemp-based products are too restrictive and don't work as well as they should. Frequently you will hear those people say things like, you know, hemp is it's just industrial hemp and it's very low quality and it doesn't really work very well, et cetera, et cetera. On the other hand, you'll hear proponents of hemp-based CBD tell you that it's just as good as all other forms of medical cannabis, and everything else is overblown. So let's just look at hemp for a second. This picture here on the left is a picture of sort of old world industrial hemp. These are plants that are harvested for fiber. They are not harvested for CBD oil or for anything medicinal, although originally when CBD oil first became a thing, there were companies that were growing hemp like this, trying to squeeze a little bit of CBD out of their plant and make a little extra money. You know, the concern with these plants are, number one, the quality was not very good because they were never genetically sort of designed for that purpose. And also because they're grown for fiber, frequently there was concerns about things like pesticides, herbicides, various toxins that may have wound up in the medicine. This, on the other side, is medical CBD, medical hemp, that was grown and harvested in Colorado last year, 2017. As you can see, there is a world of difference between these two plants, and any of you that have any experience with cannabis in your life I'm sure will agree that there is no way to tell just from visually looking at that is not a high THC full spectrum cannabis plant. These plants are of much, much higher medicinal quality than their cousins to the left. And as such, there are a lot of medical value to today's hemp-based CBD products. Now, I do believe that there are certain indications that they may not work as well for, because THC is a very biologically active compound and can be very useful, but I certainly would not write off hemp-based CBDs, particularly because they are so readily available, especially in states where you may not have access to medical cannabis like we do here in California. So let's talk about dosing for a moment, because at the end of the day, that's really what's important, right? Safe and effective dosing. So THC is always going to be the limiting factor when dosing, because that is the compound that is going to cause toxicity. So when we look at products that contain THC, this is a good dose range to start with. Somewhere between 0.1 and 0.25 milligrams per kilogram divided twice daily. And again, this is a starting dose. Potentially doses can go higher than that depending on the clinical indication and the response of the patient. But these are generally considered safe doses to start at, where you don't have to worry about toxicity. I always recommend, I always suggest that when people are going to use cannabis, or when veterinarians are going to guide people on how to use cannabis, that you start slow, you start low and go slowly. So we want to start at a low dose and go and increase slowly. And there's really two reasons for that. The first one is just like with people, animals will develop a tolerance to the psychoactivity of THC. So over time, they can take more THC and hopefully get more therapeutic benefit without the psychoactivity causing complications, because it's worth me saying that under no circumstance is a stone dog ever going to be an acceptable outcome. So the goal here is to dose these medications without there being any outward side effects other than positive. Another reason for starting low and slowly increasing is the biphasic dosing curve. You'll recall that there is frequently a sweet spot with these animals, so we don't necessarily want to start them on too high of a dose and potentially find ourselves on the wrong side of the curve, if you will. So when we look at CBD, there is an enormous dosing range for CBD, anywhere from as little as 0.1 to upwards of 4 milligrams per kilogram divided twice a day. Remember, Dr. Wachschlag's arthritis study, they were using 2 mg per kg twice a day in these animals to get a therapeutic effect. So because CBD does not have the profound psychoactivity that THC does, you can get away with much higher dosing. And in certain circumstances, particularly in sometimes difficult seizure cases, sometimes these higher doses of CBD are really going to be necessary. And just like THC, start low, go slow, and always keep the biphasic dosing curve in mind. So when we're looking at, what do we need to keep in mind when we're looking at safe and effective use of cannabis? Obviously, we need to know the amount in milligrams of THC and CBD being provided, as well as the ratio of the two. When sourcing a particular product for an animal, it's important to find something that is going to be of a concentration that you can accurately dose in an animal. Some of these products that are made for people are so concentrated that when people buy them, they're instructed to take a grain of rice size as a dose. To me, a grain of rice is not an accurate dose. Of course, my mind, I'm always going, is that long grain, short grain, basmati? Is it wild rice? What are we talking about here? So you can't dose based on the size of a piece of rice. Cannabis comes in a lot of different product formats. It comes as dried plant material, so dried flowers, which honestly are very difficult to accurately dose in any way in animals, and I wouldn't suggest it. Liquid preparations tend to be the best option because liquid preparations, you can modulate the dose very easily. Obviously, there are edibles out there for animals, particularly these CBD treats and whatnot. And those are fine, although I think it does also bear in mind just going back and remembering those pharmacokinetic studies of CBD and starting to ask yourself how much of the CBD in that dog cookie is actually going to get into the dog after the first pass effect. I think that definitely is something to consider when you're starting to think about dosing. And then, of course, there's edibles for humans, brownies, cookies, what have you. These are an absolute no across the board for multiple reasons, not the least of being edibles for humans tend to be very, very strong to the point where, just like the dog that died of aspiration pneumonia I showed you earlier, that was from ingesting human edibles. In addition to that, remember that a lot of human edibles have other compounds in them that may be toxic to dogs, such as chocolate or raisins. So, there's no way that there's any need to dose an edible, a human edible for a person. The landscape right now, as far as buying cannabis products, it is the Wild West out there. Whether or not you're buying hemp-based CBD online or you're going to a dispensary and you're buying things from a dispensary, there is little to no regulation in any of this stuff. So, for those of you who may be sort of familiar with using natural supplementation, herbal therapy, those sorts of things, you'll realize that, the FDA is not really monitoring, nutritional supplementation. And every now and again, you'll see a story on the news about some expose where they pulled a bunch of supplements off the shelf and found that most of them didn't even contain what it said on the label. Similar things can be true with cannabis, and as I would suggest with any other natural product, it is very important to do your homework and know what you're buying and who you're buying it from. Products can be labeled incompletely, meaning like they don't have the THC to CBD ratio on there, or maybe they don't tell you how many milligrams is in a dose. If that's the case, how could you possibly accurately dose anything? Labels can be inaccurate. It may be that a company is not routinely having their products analyzed, so from one batch to the next, they may be wildly different as far as content goes. The source material, where's it coming from? Where was it grown? How was it grown? These things are very, very important when we're talking about medicine. Production methods. These days I think it's happening less and less because people are aware of it. But not that long ago, a lot of cannabis extracts were being produced with organic solvents like acetone. Clearly, that is not something that you want to be giving your patient, if you're trying to provide medicine. And then look for a certificate of analysis. A certificate of analysis is a certificate from a diagnostic lab that tests products for both their medicinal content, so cannabinoids and even potentially terpene spectrum, but they're also looking for contaminants. They're looking for bacterial toxins, fungal toxins, fertilizers, fungicides, these sorts of things. You want to make sure that what your patient is taking is clean. And unfortunately, there's nobody out there to sort of regulate that except for you. Or the pet owner. So these are very, very important things to remember. And lastly, if you do live in a state where you have cannabis dispensaries, I will forewarn you that while the people that work at dispensaries are frequently very, very well-meaning, they're not doctors and they're not veterinarians. And I have heard some stories of people getting disastrously bad advice from these folks, and there's something about the road to hell being paved with good intentions, right? And I think that this is a classic example of that. And this is, of course, another reason why we as veterinarians need to get into this conversation, so our clients are not getting advice from the guy that works at the dispensary or whatever it says on the internet at 3 a.m. So as we're kind of coming around to concluding things from the medical standpoint here, a couple of take-home messages I'd like to leave you with. The first one is that cannabis is a highly pharmacologically active compound, and it is best to think of it as a prescription strength drug. As I'm sure you are all aware, increasing numbers of people are having very personal and positive experiences with medical cannabis, whether it's something that they've purchased online, hemp-based, or a full-spectrum medical marijuana product. As people have these positive experiences with themselves or their family, they are very naturally going to want to see if the same benefits will apply for their pets. And this is where we come into the conversation. As we just showed in the survey at the beginning of this talk, we veterinarians are fielding cannabis questions a lot. And lastly, appropriate preparation and dosing is essential to success of using medical cannabis. So there's a lot to think about here, this is why I'm so happy that everybody's joined in today. From the standpoint of really starting to understand how all of this works. And lastly, regardless of how people may feel about it, medical cannabis is not going anywhere. And quite frankly, all indications would point towards it is only a matter of time before the federal government reschedules cannabis into a Schedule 2 or 3. As I mentioned before, GW Pharmaceuticals already got Epidiolex approved, which is a cannabis-based medicine. It's just a matter of time until this happens. So as a profession, we need to be ready for this. So let's take a moment before we wrap up the discussion today to talk about the elephant in the room, because it is a big one. And, you know, obviously the elephant is the legal situation here. We as a profession are in a very, very tricky spot as it pertains to the use, recommendation, discussion of medical cannabis, and depending on what state you live in, it may be more or less problematic. So cannabis prohibition for animals has really forced pet owners to take matters into their own hands. So there is not a law in any state in the country that specifically allows veterinarians to have the discussion with pet owners about how to safely and effectively use cannabis. And if you live in a state like California, you have been effectively threatened by your veterinary medical board that if you do have this conversation with clients, you put your license at risk. This is a ridiculous and an untenable situation given what we now know about the medical benefits of this medicine, and because of the fact that, like it or not, it's here. Even if somebody does not believe that cannabis is effective medicine, that does not change the fact that clients are coming into your office and asking these questions, and we have to be able to tell them something. As I said earlier, legalities are going to vary state by state. Currently, 29 states plus DC have medical or recreational cannabis laws on the books, and this is why I say, regardless of what some politicians say out there, this train has already left the station. It's just a matter of time. And also, as I mentioned, no state has any specific legal language allowing for veterinarians to recommend cannabis for their pets, although, as I will show you in a moment, that may be about to change. Hemp-based CBD products, however, are legal across the United States unless you happen to be unfortunate and live in Wisconsin, in which case they are expressly illegal. In case you're not aware of it, there have been quite a lot of legal challenges and legal wrangling in the courts in the past year as it pertains to the status of hemp-based CBD and its relative legality. It's going back and forth. As it sits right now, it does not look like the CBD industry is in any great danger, but there absolutely are factions within the federal government that would love to see it be expressly labeled as a Schedule I substance, just like THC, so they can compare it to heroin and pretend like it's like it has no medical value, even though it so clearly does. So, what is the federal position? Well, certainly given our current administration, there is no significant political will to reschedule cannabis, although at some point that will change. The 2018 Farm Bill, which was introduced by Mitch McConnell, does include hemp in it, which would certainly help legitimize hemp and CBD. And to give you an idea of how quickly this story is moving, this bullet point I put in here about Senator Chuck Grassley making a proposal to remove extracts and cannabinoids from the definition of hemp, I put that in this presentation yesterday, and today that's no longer relevant because the Farm Bill passed and Grassley's amendment was not added to it. So as it sits right now, the hemp is included in the Farm Bill, which is going to be a very, very comforting safety blanket for the entire hemp-based CBD industry. So just to give you a bit of an example of some of the legal issues out there facing veterinarians, let me give you a little bit of just a quick background on what's going on in California. Early in 2017, the Veterinary Medical Board in California released a memo to every veterinarian in the state, and in part it said the Veterinary Medical Board does not have a formal position on the matter of marijuana and hemp use on animals. However, if the board were to receive a complaint related to a licensee's involvement in the treatment of an animal with marijuana or a hemp-related product, the board would be obligated to conduct an investigation and take appropriate disciplinary action. Effectively, what that did is that was an implicit threat to every veterinarian in the state of California that if they got anywhere near the use of cannabis of any kind in their patients, they were putting their license at risk. And the result of that was very understandably most veterinarians backed away from the topic, and certainly none of us could blame them for that. Unfortunately, the reality is that memo came out almost exactly at the same time that recreational use of cannabis became legal in California. So all of a sudden, anyone over the age of 21 in the state of California could walk into a dispensary and buy cannabis, and many of those people were looking to use it in their pets. So we've got all these pet owners that are buying cannabis, and they're using it in their pets, and they're talking to the guy that works in the dispensary about how to use it, and they're talking about to the folks at the pet stores and how to use it, and they're going online and they're asking Dr. Google how to use it, and the only people in the entire state that are legally forbidden to discuss how to use cannabis safely is the veterinary community. So, this is the situation as it sits in California, and that really sparked a number of people, myself included, to take up the mantle and try and make a common sense change here. As such, in California, we now have an assembly bill that would allow veterinarians to quote, excuse me, I have a typo there, and I want to correct that. The bill does not say that it allows veterinarians to recommend cannabis. It allows veterinarians to discuss cannabis. Excuse me for the miswording. It does make a big difference. The definition of discuss and recommend, depending on who you ask. Recommend would essentially allow veterinarians to to send people to dispensaries to get cannabis products. Discuss, at least hypothetically, is a little bit more of a vague term, although I think it is, I think from a legal definition standpoint, everybody who's looked at this seems to feel like there is going to be no way to sort of legally define discuss versus recommend. Regardless, if this bill passes, it will be the first of its kind in the country. And my hope is that it will be the bellwether for the other states to take up the mantle and allow veterinarians to get into this conversation for the safety of our patients. And I also want to take a moment to thank a lot of the people in the veterinary community and the cannabis community who have helped make AB 2215 a reality, particularly Susan Tibbin and Paul Hansberry. These are two people, artisan cannabis and medical and medicine makers in Northern California for years and years, and ardent and fervent activists for medical cannabis use, and they have put more time into making AB 2215 than I can even possibly explain. We all owe them a debt of gratitude, particularly as this trend spreads across the country. So as we start to just wrap this up, let me leave you with just a couple of other things. Just a couple little takeaways from this. Know what you're giving and or recommending to your patients. It's important, it's critical to know the THC to CBD ratio and the number of milligrams of THC and CBD per dose, and specifically the amount of THC to avoid any chance of toxicity. As I mentioned before, start low and go slow, both from the standpoint of allowing for your patient to become accustomed to the effects of THC and limit side effects, and also because of the biphasic dosing curve. That way we'll be able to find out what the optimal dose will be. Always avoid edibles for people. There's no reason why those should ever be given to animals. And just as a personal request, we as veterinarians should always be the medical advocates for our patients. And it may be that that there's differences in public opinion, that there's differences of opinion within the veterinary medical community, there's differences of opinion within our veterinary medical boards. But if we are not going to be the ones to look out for our patients, nobody will. So I would leave you with that. and hope that we have covered enough here that you have a better grasp on how cannabis works, why cannabis works, and what it can be used for in a clinical setting. So at this point, I will go ahead and open us up to questions, and let's see how many of those we can get through. And I hope I can answer things for you.
Thank you, Dr. Richter. Can you hear me?
Yes.
So this was wonderful. I think we all learned a lot. We have a lot of questions to get through, so that's really great. Some really thoughtful questions. So what I'm going to start with one from Kim. It's surprisingly, right? She said there's a lot of conflicting information on the internet, and she's wondering, does THC need to be heat treated to become active?
That's an outstanding question, and I'm so glad that you asked it. So THC, as it is formed on the plant, is what's called THCA, or it is the acid form of THC. Now, THCA is absolutely biologically active, although it is not psychoactive, and it does not necessarily have the same spectrum of activity as delta-9 THC. The conversion of THCA to delta-9 THC happens when it's heated. So to answer your question, if we want delta-9 THC, then yes, the plant itself will have to be heated at some point.
Okay. All right. That's great. Thank you. I'm going to ask you about some specific situations. I have a few of them here. You had mentioned that there were many studies about pediatric seizures.
Yeah.
And folks are wondering about whether or not there have been studies or what your experience is treating seizures in dogs.
To my knowledge, there have been no studies published specific to seizures in animals. I can tell you that I have seen a lot of animals, both dogs and cats, have their seizure frequency reduced and their seizure severity improved on various forms of cannabis. Now, usually the thing to start with these seizure cases are CBD dominant products, but that is absolutely not written in stone. Every individual is going to react a little bit differently, but that is a real good place to start.
Okay, and specifically, someone was asking about seizures in a 4-pound puppy that had distemper. Right.
That's really fascinating. I will admit that that's not a situation that has come to me, not the size of the animal, but the distemper part. I think it's unclear whether or not cannabis, or for that matter any other medication, may be able to have an effect on that, because clearly in the case of distemper there was almost certainly some neurologic damage done. So a lot of it probably has to do on what the level of damage is, but I would think that at the very least it's an appropriate indication to try cannabis in an application like this. Whether or not it would be effective is an unknown.
Okay. Jennifer was wondering about vestibular disease. Do you have any experience using cannabis?
I've not seen it help vestibular disease from the perspective of actually shortening the course of the disease itself, but I think from the standpoint of helping with the nausea and the anxiety, absolutely yes.
Oh, great. Okay. We have people who are wondering about cats. Anything specific in terms of safety, efficacy about cats?
Yeah, again, I mean, there's not much by way of research out there, but just clinical experience, the dosing, the milligram per kilogram dosing that was in the presentation is applicable for cats as well. Obviously, you just wind up with lower doses because they're smaller. Now, cats do not display static ataxia like dogs do. But certainly they are prone to the psychoactive effects of THC. So those are whenever looking at a cannabis preparation in an animal that small, that's when it's really important to make sure that you're using a a product that is accurately labeled so you know exactly how many milligrams you're giving.
Okay, great. And what about feline lower urinary tract disease?
That's a real interesting question because as you know, I mean, feline lower urinary tract disease is kind of it's a multifactorial disease, right? So I mean, there's a stress component, which clearly cannabis may be beneficial for. It has anti-inflammatory effects as well, which cannabis can also be beneficial for. I think in the sense of helping with pain and inflammation and sort of the stress of all of it, I think it's definitely applicable, sure.
How about horses? Any experience with horses?
You know what? I do not treat horses in my practice. I can tell you that Dr. Rob Silver in Colorado has looked at equines and cannabis a little bit. I honestly don't know enough to be able to give you any sort of dosing information, but there are people looking at it.
Okay, great. Elaine was wondering if the inhibition of angiogenesis might pose a problem for non-cancer patients.
I would say no. Although to be clear, I mean that's sort of an intuitive answer on my part. I think if you look, it's interesting. If you look at there's a lot of natural compounds out there that have anti-angiogenic properties, and none of them are generally thought to be unhealthy to ingest because you don't have cancer per se.
Right.
Obviously, the thing with cancer is you're dealing with angiogenesis sort of turned up way higher than it ought to be. It's never been my impression from looking at the research that it would affect normal levels of angiogenesis.
Okay. Couple of people said that they learned in veterinary school that THC toxicity can cause fatal bradycardia. Is that something you've seen, heard about?
No, that is not something I have seen or heard about. And as you can see, I've seen some pretty bad cases. But I've never heard of a dog developing fatal bradycardia from THC toxicity. I wouldn't say that it is absolutely impossible, but I don't think that is something that happens, and I think that has a lot to do with where the endocannabinoid receptors lie. That's for example why that doesn't happen in people either. And as you might imagine, people sometimes accidentally ingest ungodly amounts of THC, and it's not really physiologically possible to cause bradycardia or apnea with cannabis.
Okay. Is it a good appetite stimulant in animals?
That's a question that I get a lot, and from what I have seen, I think the level of appetite stimulation that we see in animals probably has more to do with the relief of gastrointestinal upset rather than some sort of like centrally acting appetite stimulation effect. For example, like if you were to give a completely healthy animal cannabis, it's not like you're going to see them get the munchies per se. But if you have an animal with chronic GI upset and you make them better, then clearly they're gonna eat. So I would say no, I don't think it has really profound appetite stimulating effects.
Okay. Can you talk about our geriatric patients?
Sure. From a geriatric patient standpoint, you think about the things that we're often dealing with the geriatrics. So we're dealing with chronic pain, we're dealing with cognitive issues, so anxiety, confusion, that sort of thing, sometimes gastrointestinal issues, and as you've seen, all of those indications are on the list for cannabis. So I think when we're looking at particularly supplements to sort of help these geriatric patients be more comfortable and more at ease, I think that is absolutely something to look at. Although I think that is also a really good indication to look at low dosages to begin with, because some of these older guys can be quite sensitive to medications And you know, the last thing that you want to do is take a dog that's already having trouble walking and make it so he can't walk.
Right, right. Okay. Many people are asking if you have any brands that you are willing to recommend.
That's a tough one. You know, to be quite honest with you, I don't really feel comfortable in this forum sort of discussing specific brands. I apologize if that disappoints people, but you know, there are a number of very good quality hemp-based CBD products out there. You know, one need only look. And as far as more specific medical cannabis products, you know, those are very specific within, they're only available state to state because none of those products can cross state lines, federally speaking. So, for example, the products that you know, that you could buy here in California, you would not be able to buy in, say, Washington, Oregon, or Nevada. So it's kind of a very local thing.
Now, and someone in Washington is saying that she has dispensaries all around her, but she doesn't know, is there a lab or someplace you can have things checked to know whether or not it is what it's supposed to be?
Yeah, there absolutely is, and I don't know who the labs are specifically in that area, but that would not be a difficult thing to find out. What I would suggest that person do, go to a dispensary and talk to the people that work there and find out, you know, what lab is doing the analysis there, and also you know, maybe talk to the people there and start to get a feel for who are some of the better quality medicine producers in your area, because you know, one of the things that you can do is you can get in touch with these people directly and talk to them about products that you want or you need for your patients. So you know, one of the things that I have found about folks that are medical cannabis producers is these people are doing their job for the sheer love and passion of it. And not surprisingly, many of them, just like many people, are animal lovers. And if you go to them and you say, hey, I'm a veterinarian, I really need some products that would be appropriate for my patients. Is that something we can talk about? I think you'll be pleasantly surprised at the smile that you'll get back. And you may wind up, you know, being able to work with somebody who can make specific formulations for your patients.
Yeah, that makes a lot of sense. There are several people asking about their states in particular, and I'm thinking that maybe people need to contact their local VMAs or their local veterinary boards to see what the laws are in their own states. Does that make sense?
It totally makes sense, and you know, I will say it's fascinating that you know, in most states, I think California being the exception, even though there may be no specific state law allowing veterinarians to discuss or recommend cannabis, you know, the veterinary medical boards have just sort of very wisely chosen to stay out of the conversation. You know, for some reason that I have yet to figure out, the veterinary medical board in California decided that they needed to get involved, and they needed to tell veterinarians what they thought about the use of cannabis. Yeah, but I mean, if you have concerns, then yes, I would absolutely suggest that you get in touch with either your state VMA or your state veterinary medical board, and find out if there's a policy or if there is any sort of political will to you know, to allow veterinarians in the letter of the law to get involved with cannabis.
I have heard about some state boards who have said that they probably would not pursue this, but you know, I don't know whether if something was really pushed or if something bad happened, whether they'd have to change their mind about that. So I think it's important to talk to your local boards.
Yeah, I would agree. And if I could just interject for a moment, you'll see on the screen here at the bottom, I've got a Facebook page, Veterinarians for Patient Safety. That's a Facebook page that I created as it's exclusive for veterinarians. So this is a place where you can go and you can, you know, if you want to have these discussions with other colleagues, this is a good, safe place to do it. which hopefully, maybe you can get some questions answered by other professionals that are in your area as well.
Right. Right. That makes sense. People are worried about so I just want to mention to our audience that we are coming to a close. We know that we're coming to the end of our time. We do still have several more questions, and we have a lot of people still on the line. So I'm just going to ask a couple more questions, and then we are going to wrap it up. So does resistance to CBD develop?
That's a good question. I think that the endocannabinoid system there is going to be some degree of adjustment, if you will. If CBD or THC is given over the long term. Although I will say that I don't think that I have seen a decrease in therapeutic benefit over time. Mm-hmm. I think in that sense, as long as you're using appropriate dosages, it seems like it's not a clinical problem.
Okay. People are wondering also about what is about the time of onset once you give these products.
That very much depends on how it's given, but since most of these products we're talking about being given orally, if you're talking about something that's ingested, could be anywhere from 1 to 2 hours. If you're talking about like an oil that's given directly orally and there's going to be some transmucosal absorption, it could be significantly less, maybe as little as 20 to 30 minutes.
All right. So we are leaving some questions on the line here, but I do think that we're going to be needing to wrap it up. One last thing that can you just mention something about the DEA license? People are concerned about their DEA licenses.
Sure. So here's what I'll say about DEA licenses, and I will tell you that I've spoken with many people about this, and I will relay my understanding of this. Obviously, we all have federal DEA licenses to prescribe controlled drugs, etc. The same is true for physicians that work in states with medical cannabis laws. There was a case in the federal courts years ago called Conant versus Walters. If you want to look it up, Conant versus Walters. And essentially that was a case where the federal government tried to prosecute a physician for using medical cannabis in his practice. And the decision of the Ninth Circuit Court of Appeals was that the federal government cannot interfere with a physician as long as they are practicing appropriate medicine that is within the laws of their own state. So the bottom line here is, for the same reason that an MD can recommend medical cannabis to their patients and not be worried about their DEA license, the same should be true for us as veterinarians. And I say should because, that is not something that has been tested in the courts. It makes intuitive sense that, that healthcare is healthcare. But again, that's as much information as I can provide.
Okay. All right. Well, that's great information. I can't thank you enough. This was really wonderful, obviously very timely, and a lot of people very interested. And thank you for sharing your contact information. I'm sure you'll be hearing from some folks. So everybody, we're going to wrap up and hope that this information was helpful to you. And we'll see what the future brings. I think that things are going to change. Just want to remind everybody that in order to get your CE for this, you need to complete the survey that will be coming in the follow-up email. And also, if you want to give us suggestions about future webinars, we'd love to have those. If you're listening to this webinar and the archived version of it, you need to take a quiz in order to get the CE. So right below your screen, you'll see a link to that quiz. If you're here with us live tonight, you don't need to take a quiz, no problem. So we're off for the summer, our webinar series is, but we'll be returning on Wednesday, September 12th, and our webinar is going to be Veterinary Clinical Trials, Balancing Rewards and Risks for Your Clients and Patients. We think this is really going to be a great one. Dr. Jenna Burton from UC Davis and Dr. Craig Clifford, who's a private practice specialist in New Jersey. So we're going to have different perspectives about clinical trials, and I know that a lot of you are interested in learning more about how to enroll your patients in clinical trials, and we think this will be a really good one. And don't forget our archived webinars. So thank you, everybody, for being here with us tonight. Thank you, Dr. Richter. This was fantastic. Good night, everybody. Have a great summer.